Good morning, everyone. Welcome to the third edition of Live Local Lake County, where we highlight different organizations that provide amazing services to our county. Today, we have two special guests, Gale and Demetrius, and they are going to first give us a little background about themselves and some background about the organization that they represent. Good morning, Gale. How are you?
I'm doing great this morning. How are you?
Good, thanks. So Gail, can you just introduce yourself and tell us a little bit about how you got where you are and about the organization you represent?
Yes, my name is Gail Graves, and I'm the Interim Assistant Director of the Waukegan Public Library. And my normal work is really filling in that gap in terms of needs and resources in adult education in our community. I like to say we're the pre before the pre. If you're looking for workforce development, then we help our community members get there. How I actually came into working with the AACP is a natural fit for a community, and it also fits in with my passion and concerns to address community needs.
Wonderful. I love that filling in the gap, and this COVID has really shone a light on to the gaps that were always there but are just huge now.
Absolutely.
Great. And Demetrius, can you tell me a little bit about yourself? Introduce, how you got here and what your participation is in the organization?
Sure. By profession, I'm a registered dietitian. I've been with the Lake County Health Department for 9 years. Now I'm their manager of clinical nutrition. So that's my job with them now, and really designing community interventions having to do with disease, addressing health disparities, especially diabetes, all these other kind of things that unfairly kind of attach themselves to certain parts of our population. So those health disparities were something that we were already diving into. So it did feel like a great transition to be on this platform for the organization we're going to talk about today, AACPG.
Okay. Yeah. And then highlighting again the differences between the services that you perhaps provided pre-COVID and now the services that you're providing post-COVID. So if a resident is watching this, what would you want them to know about the services that are offered and what you can provide to them? This idea of filling in the gap. Is there something specific that you can say that you offer right now with COVID issues? Or is it just a continuation of regular services that you've always had that existed?
For the AACPG?
Yes.
So for the African American Community Partnership Group, what we're doing is we are this platform, and Gail, feel free to jump in. We are this platform to really to be a resource for the community. That's why it was established. So the education, the COVID-19 issues that are affecting certain populations and more than others. And we know that African Americans we're contracting or getting tested and testing positive for 4 people versus 1 of our white counterparts. So
I was just going to ask if you can expound on that. Do you have some data? I don't want to put you on the spot, but I've heard the numbers that there is this huge disparity. Do you have data on that?
So the Lake County Health Department is specifically tracking this, and even on a bigger scale. If you go and you type into Google Lake County Health Department Hub, if you go to that website, it'll actually break down not only who is catching it more, but also what locations within Lake County, what cities within Lake County are having higher challenges with COVID-19. So it really paints the picture. So we really encourage people to go there. And for us, the AACPG, we use that as a resource when we are trying to plan and really come up with solutions to the challenges we're having with COVID-19.
Wow, that sounds like it's a really great tool. I haven't been there. Go ahead, Gail.
Oh, I was going to say, just to add to what Demetrius was saying, we were really convened out of the fact that COVID is having such a ravishing effect in our communities throughout Lake County. And so the Lake County Health Department wanted to say, how can we address this, but at a grassroots community level? And I think that's the biggest thing. Everyone who's a member of the AACPG, we're representing organizations, nonprofits, communities of faith, and we've all come together to first address and try to mitigate the effect of COVID-19 in our communities of color in Lake County, but then to look beyond that, broader, at health disparities.
Yeah, the as you're talking, I'm like, I forget that I'm supposed to be asking questions because it's just the disparity part has really just uh, really affected me, and trying to educate our neighbors that maybe aren't as touched by it. And we treat some of these symptoms as silos, as individual pieces, and until we see that everything is interrelated and how we got to the place that we're at with not investing in our communities of color, and just the lack of resources, and that when we have the people that are considered essential workers that are of people of color, and yeah, it's just shining a light on that. I guess I didn't realize that the group itself is organized of other smaller groups that you have. You said, can you explain some of those groups that are part of your group?
Sure. So we are organized with representation. Again, there's some community members, there's people from nonprofits. So people like Catholic Charities, Park
Okay.
Place, various communities of faith, different representation from various churches across Lake County. CAPS, Community Action Project of Lake County, just to name a few, because then you get in trouble when you don't name someone. But we have really a committed core where we're divided out. So our principal focus is health and education and self-care, which is our term for mental health. And the whole idea is to bring together these voices from the community that then represent those that are hardest to find, don't have a voice, don't have an avenue for speaking up, identifying what are their needs, what are these gaps, what are the resource needs, and collaboratively coming up with solutions and resources. And I think really that key for us is collaboration. We're here to help those that are already doing work, but help them to engage with the community, bringing them resources, removing barriers, so that that work of all of us together can be more effective.
Yeah.
Go ahead, Demetrius. So it looks like you wanted to chime in. Go ahead.
Yeah. So with this group, we know that there are great organizations throughout Lake County that are doing different things. What we've done is we have this platform where all of us can come together and we can work with some of the organizations that are already established, that are already doing fantastic things, but sometimes we don't know about each other, or sometimes we don't know all that that organization is doing. So by working together, we kind of create these overlaps and we don't have people falling through those gaps that we see now. That's the idea of what we're trying to work towards.
That makes a lot of sense. It's like pooling your resources, and those that are on the ground, they know, they have their ear to it. They know what the needs are in their local communities. So that grassroots effort really does match up the services with the needs. And I think that was what the whole reason behind organizing on Friday mornings with all the human services groups at 8 o'clock that get on that call. There's anywhere between 30 to sometimes 50, 60 organizations represented in Lake County. And that was the other reason why I wanted to do this, because there are so many people that have been doing such good work for decades in the trenches, really fighting the good fight. So I want people to know that you've always been here, that these organizations have been working night and day. It's just right now, the disparities are so huge and the needs are so great in our more fragile communities that it's kind of imploded. So I don't want people to think that you just kind of popped up. This has really been an ongoing effort in our communities to raise people up. Does that sound right?
Absolutely. There's been ongoing efforts. And, as we've moved into COVID, there's a realization, though, that grassroots, being able to tailor how you address issues is really important. And so through the Lake County Health Department, when these initiatives were convened, so we've actually only existed since the end of May. So when
your group itself, like the coalition together?
The coalition together has only existed since May, end of May.
Okay.
And then you're going to be talking with the ACL, which is the Latino coalition. It's come out of this same COVID impact in our fragile communities. But when we came together, it's also in recognition of the fact that while we've all been doing this good work, what oftentimes has been missing, though, is the voice of that community at the table. And so sometimes all these great resources and solutions have come, but they've not been able to reach into the community as well. And so through this grassroots effort, it's really connecting those which are hardest to find. It's like the census, it's like voting. So we're not limited to COVID-19. There are social justice issues. There are digital literacy issues that we are addressing through this initiative because they're all related at some point, right, to health disparities, towards disparities in the community.
Yeah, in teaching, we call that meeting the people where they are. And
Absolutely.
it's like if your student is here, you need to come down there. But at times we try to make people come up to our level. So that's what you're saying, going right into.
Absolutely.
Yeah, meet people
Absolutely.
where they are. It's way more effective, and you know how to do that. Demetrius, were you going to?
And even through, we're trying to provide education. So we are on social media. We're trying to host these different topics that we know speak to what's going on in the community. And that making it right there for them and right there for everybody, and bringing all these organizations in. What do you think? What do we need to talk about? How do we get the education out? Is it pamphlets that we need to be having? Or is it Facebook Live events? Or is it Instagram? Or do we just need to meet at the churches? We have to get together and just brainstorm and really find out not just one way, multiple ways that we can really get out into the pockets to really meet the people where they are, like you said.
Well, that brings a real great segue into how can people help your organization? Like what would you want the public to know and how they can help?
So one is to collaborate with us. The more that people are learning about the work that we're doing, we look for collaborators. Again, no one can do the work by themselves. And so does that mean that a person or an organization might become sort of this part where they're working in the trenches with us? They might be part of the network where we communicate out, and we need others, as Demetrius was saying, to help us communicate those messages out. We have people that are interested in volunteering, working with us on voter registration or on census projects. We have, the one thing we haven't talked about is a huge PPE, personal protection equipment project, which is part of education. And I wanted to highlight our whole education is about positive. It's not about what people are doing wrong. It's about what people can do in the times of COVID. We don't chastise people because they don't have the money to spend on masks and hand sanitizer. We want to help get that to you. So to that end, the whole group, both of us, we're putting together, and we've been funded through the CARES Act to put together 70,000 PPE kits to get into the hands of our most vulnerable. I'm not talking about you and me that can go to the store and buy our masks, but those that are most vulnerable, our elders, those who don't have the income, they might be unemployed, but in these fragile communities. But any fund shows up, we're not going to turn you away, so that we're giving out these kits, and we're giving them to, as Demetrius and I have highlighted, established networks, communities of faith, nonprofits. If you're delivering meals and you're going to someone's door that is elderly and can't get out, then we want to provide that mask, that kit, to help you be able to better serve that person.
That's really great. 70,000. It
so
sounds like a lot.
70,000, right, is between the two groups. So that's, an estimate of trying to get to many of the African American and Latino community members throughout Lake County. And so we've been very fortunate to have donors to, again, apply and receive grant funding to help move these initiatives forward.
I'm just thinking, like, a lot of the local churches have their own food banks. I know my own church does. So would that be an organization that if they needed PPE to serve their clients, they could reach out to you guys and say, is there any way you could provide PPE either for the people working the food line or for the people that are coming to the food line? Does that sound like something that you would connect?
So Yes, like the idea is that we would have things available. So that's the easy answer. Just with the intricacies of it, we just want to make sure that these PPE kits get in the hands of people who do not otherwise have it accessible to them. So in the kits themselves, we're looking at reusable masks, disposable masks, education about COVID-19 and the community. And also we put in there census information, voter information. So we really want something that once you have it in your hand, we've actually satisfied, at least temporarily, a lot of the information that you need right now.
You know, I was thinking of a story of when I was a teacher, and just that information component can be so vital. When I had a student that was injured on the playground and didn't come back to school, the phone was disconnected. So I finally went to their home and asked why they weren't there. And they said because they didn't have a health clearance from the doctor to come back because they couldn't afford it. And I thought, how long would the child have stayed out of school had I not gone there? And it said, okay, let's get that solved. So that's kind of what you guys are doing too. It's sometimes we take for granted what the solutions are, but there's some these are major barriers that where some of us who are privileged, we just, it's a simple solution, but for others, it can be a matter of life and death, like protection and safety or not. So I love, this is exactly what we wanted to do, is highlight groups like yours and the wonderful work you're doing. You're in the trenches, and I'm hopeful that we will be prepared for this next wave that comes through, but it's almost inevitable with the weather and when we start closing our doors and windows. So it sounds like you guys are, ready to go for the second wave. And let's get an update in a couple of months and see where you are, and see if we can continue the conversation and see how we can help you with your organization.
Well, thanks
so much for your time. Is there any last comments that you want to make before we close out?
There's a lot of great work being done out there already, and we just feel like it's a little siloed right now. But what we're doing is we're connecting fraternities and sororities with social organizations, communities of faith with hospitals, government agencies with essential workers. Like, we're trying to make these connections, much like you went to somebody's house and really needed to find out what's really going on. And we just want to make sure that people can reach out to us, and you can find us at AACPG Lake County at gmail.com, or just go to our Facebook page, AACPG Lake County, and you'll have all of this information about us. Reach out to us, because we want to be that bridge to the communities that you're serving, and that we want to make sure that we help.
Wonderful. Gale, any last comments?
I would also say that in response to the work that we're doing and the issues our communities are facing, we have been met with a lot of community support, which we appreciate. And there's never enough feet on the ground to get the work done. So again, reach out. We can figure out ways to work together, or as people want to volunteer on different initiatives. Demetrius has given you our contact information, so reach out.
And and we will, oops, my phone's ringing. Oops. Sorry about that, life. We'll put all that information on this posting when we do it on Facebook, and hopefully we can bring some attention to the organization. Thank you so much for taking some time out from your day. It was really an honor to meet you both, and keep on trucking.
Thank you so much for this.
Yeah.
Absolutely. Bye-bye.